Are you ready to learn with fun? Brace yourselves for the ultimate test of knowledge in the Cardiac Super League. Witness the clash of giants as 12 formidable teams step into the arena, battling it out for cardiology supremacy. In this exciting collaboration between Wilson's Pharmaceuticals and the Pakistan Cardiac Society, the Cardiac Super League promises intense competition and groundbreaking learning experiences. Stay tuned as the teams showcase their expertise, strategic brilliance, and unwavering determination. Who will emerge as the true champions in cardiology? The main goal of the case-based learning approach is to equip students and healthcare professionals to refine their clinical practice by learning the latest advancements. The Cardiac Super League awaits you, guaranteeing to advance your education. Join us and become part of an incredible journey. Visit our Facebook page or contact us for more information.
Thank you. Assalamualaikum everyone, this is 𝐂𝐚𝐜 and a very warm welcome in Pakistan Cardiac Society's Cardiac Super League powered by Wilson's Pharmaceuticals. Today we are live for the 5th match between PIMS Leopards and MAYO KINGFISHERS, and they are both representing Group A of the Cardiac Super League. Very quickly, let me introduce the senior faculty members available with us today. Today's umpire is Professor Mohammad Ishaq. He is Professor of Cardiology at Karachi Institute of Heart Disease, and he's also chairperson of International Society of Hypertension Regional Advisory Group, South Asia and Central Asia. And with from the Governing Council of Cardiac Super League, we have with us Professor 𝐒𝐵 He's Professor of Preventive Cardiology at National Institute of Cardiovascular Disease, Karachi. And another person, another renowned person, Dr. Professor Fawad Farooq has also joined us. He's Professor of Cardiology at National Institute of Cardiovascular and Heart Diseases, Karachi. And very soon, Professor Jalal Achisi will also join us. He's also Professor of Cardiology and head of Department at Golan Medical Complex, Quetta. And last but not the least, today's moderator is Dr. Hamza Ghori. He is Assistant Professor of Cardiology at Rawalpindi Institute of Cardiology, and he will be moderating today's match. So over to Dr. Hamza Ghori.
Thank you very much, Hamza. It's great to be back again for the 5th match of this Cardiac Super League. And today's match is going to be held between PIMS Leopards and MAYO KINGFISHER. And I think all thanks to Wilson's Pharmaceutical, along with Pakistan Cardiac Society, for making this league happen. And I think it's going to go a long way for sure. I would also like to take this opportunity to welcome our panel of council members, our stars for today, I would say, starting from Professor Dr. Fawad Farooq, Professor Dr. 𝐒𝐴𝐚𝐿, Professor Dr. Jalal Achisi. Welcome, sir. And definitely, last but not the least, Professor Dr. Mohammad Ishaq, our umpire for the game. Thank you very much, sir, for joining. So, do we have the permission from the council members to start the game?
Yeah, yes, sure.
Please go ahead.
Yeah. Thank you, sir. So first, I would like to ask both the team captains to give the introductions. So first of all, I think we can move to PIMS Leopards. Here you go.
Assalamu alaikum. I am Dr. Ali Raza Hayat, and I will be leading the team. And along with me, I have Dr. Khalil and Dr. Maria. And Dr. Muniba will be joining us via Zoom link.
Oh, I think she's already there. So it's great to have everyone. So welcome aboard and best of luck for today's game.
Thank you, sir.
Now I'd like to move to MAYO KINGFISHERS. Introductions, please.
I am Dr. Muzammil. I am the team captain. And on my right is Dr. Taki. And on my left, Dr. Rashid and Dr. Afzal.
Well, best of luck for the game today, boys. The weather is hot. I'm sure you will perform even hotter. So with this, now we move to the electronic coin toss. Hamza, is it ready?
From the screen, sir.
Okay, so here we have the coin toss. So I would randomly ask any of the two teams. I think MAYO KINGFISHERS, would you like to call heads or tails?
Heads.
Okay, toss. And we have heads. Heads it is. So do we have a winner, Hamza?
Yes, sir.
Okay, so MAYO KINGFISHERS, I think, have won the toss. So would you like to take the questions first, or you want to throw the questions first?
We'll take the questions first.
Okay. So Mayo Kingfishers, the news from the center, they won the toss and they want to take the questions first. So Leopards, are you ready for your scenario?
Yes.
Okay, so with this, we start the match. Scenario and vignette on the screen, please.
32
Go
years
ahead
old
and read
male.
it.
32 years old male presented in emergency department with worsening shortness of breath for 2 days and recurrent syncope. He denies having chest pain. There is no comorbid and no family history of coronary artery disease and sudden cardiac death. There is no history of fever recently and no history of substance abuse as well. On examination, the blood pressure is 88/58, pulse is 110 per minute, respiratory rate is 22 per minute, and temperature is 98.2 Fahrenheit. Bilateral basal crepitation are audible. There was S3 gallop. 12-lead ECG showed generalized T-wave inversions. Troponins and pro-BNP were markedly raised. His RFTs and LFTs were normal at presentation. Echocardiography showed ejection fraction of 30% with aneurysm formation and mural thrombus. His coronary angiography showed no significant angiographic disease. Cardiac monitoring shows runs of non-sustained ventricular tachycardia.
Okay. So are we ready for the first question?
I would like to see the question on board as we are facing some internet problem.
Okay, so I think we'll have both the screens simultaneously so that you can have the question along with the scenario.
So
Okay.
you are unable to see the screen, Dr. Muzammil?
Yeah. I am able to see the screen, but our internet connection is a bit unstable.
Okay.
Okay, should we move towards question?
Yes, I think let's have question number 1, and then we can show them the vignette if they want to have a look.
No, wait a second. We want to take a look at the question.
Simultaneously, you want to take a look? You want two
No.
screens?
Yes.
Can we have 2 screens?
Okay.
We can move to first screen if after the question is read, properly read.
Okay,
Completely
we can give you time to read the question. You want that?
Yeah.
Okay, please go ahead. Take your time.
We have 30%. Aneurysm with mural.
हमजा इन कार्डियक सुपर लीग की जो स्क्रीन है वो पिन करवा दें काइंडली मेयो में ना।
प्लीज करा दिया। अब वो केस अब वो पढ़ रहे हैं।
I suppose we should have some time limit for reading the case as well. You can't just have an endless time.
I think, sir, we can have a limit of maybe 1 minute. If everyone agrees, then maybe we can switch, or maybe 30 seconds. So are you ready?
You can't see the screen of Kingfishers.
You can't see the screen?
डॉक्टर हमजा, आपने ऑलरेडी एक दफा इसको पढ़ के सुनाया है, आप दोबारा कर रहे हैं, या तो फिर एक दफा आप दें इनको 1 मिनट खुद ही पढ़ लें और आपको सुनाने की जरूरत नहीं है, क्योंकि इस तरह तो बहुत टाइम निकल जाएगा।
बिल्कुल सर, ऐसे ही है। So
I think go ahead now.
चलें जी, can we have the first question? मुझे लगता है sir, I think they're having some internet issues. Okay, the first question, please read it quickly.
Question number 1 is, the patient was started on inotropic support and treated on the lines of cardiogenic shock, but the persistent hypertension led to decrease in urine output even with rapidly escalating inotropic support. In which class does this patient fall according to the Intermax classification? Option A is Intermax class 1, option B Intermax class 3, option C Intermax class 5, option D Intermax class 6, and option E Intermax class 7.
Okay, your time starts now. 90 seconds.
जब हम खड़ा होगा तो ये आवाज तो नहीं आ रही होगी ना, टिक टिक।
Come on, Kingfishers, 30 seconds left.
Yeah. Hello. Are you with us?
Yes, yes, we are with you. 10 seconds to go.
Yeah.
Answer.
Answer is C.
Answer is C.
This is
Intermax
the wrong
class
answer.
5.
This is the wrong answer. Correct answer is option A, Intermax class 1.
Okay, so we got the first one wrong. Never mind. You will have another chance in the next one. So moving to question number 2. So you get a score of 0 for this.
Question number 2. Which of the following factor does not contribute to raised filling pressure in cardiogenic shock? Disturbance in the calcium reuptake in sarcoplasmic reticulum in myocytes. Option B, impaired systolic emptying of left ventricle. Option C, increased sodium reabsorption and decreased excretion of free water. Option D, acute tubular necrosis. And option E, fluid shift to mesenteric vascular bed.
90 seconds, start now. Kingfishers, we are hoping for a 6 this time. Come on.
यार इधर चल नहीं रहा आपका यार, जल्दी से यार, प्लीज सारी मीटिंग खराब हो रही है, आईटी वाले को भेजें यार। सर आपको कहा था डेडिकेटेड लाइन पे।
Our answer is E.
Okay. Are you sure? Should we lock it?
Yes.
Okay,
Option E.
Is this the correct answer? Option E, PIMS.
Will you kindly repeat the option? Option E.
Yes, so this is option
Yes.
E. This is the
This is
correct
the-
answer. Do we have PIMS online? I mean, is Leopards there?
Yes, we are here. Yes, we are here.
Okay, so that's the correct answer, right?
Yes. Yes.
Well done. 6 it is. Well done, Mayo. Moving to question number 3.
Question number 3 is, which admission parameter poses a low in-hospital mortality in patients with acute decompensated heart failure? Option A, deranged creatinine. Option B, good compliance with medication and diet. Option C, markedly elevated BNP. Option D, non-compliance. And option E, ischemic changes on ECG.
Time starts now.
और वो तीनों तो हैं ही हैं, ये नॉन कंप्लायंस का तो नहीं है। नहीं मेरे ख्याल Our answer is option B.
Okay, are you sure? So you want to play a quick fire? Are you sure?
Yeah, we are sure.
Should we lock
Option. Can you repeat the option with the option B or option D?
ऑप्शन बी कर दो।
Option B. Good compliance with medication
Option
and diet.
B. So I would request PIMS to hold on and I will give the cue to you, right? So again, I'll ask Mayo, give me the right answer. Your answer, please.
B.
It's B. So Leopards, is that true? Option B.
Option B is the wrong answer. Right answer is option D. D for doctor,
Oh.
non-compliance.
Okay, so that's the wrong answer. Never mind. We still have 7 more deliveries, right? So, question number 4.
Can we review the third? Can we review the question third?
You want
From
to
the
review it?
umpire or-
Okay.
Yeah.
Okay. So I would request Professor Dr. Ishaq to give his verdict. So what's your query on this?
I think we should go back to the question 3 on screen.
Go back to the question, please. Can we have the question on the screen? Hamza, can we have the question? Yes. Okay, so it's on the screen.
I think
Sir, you are muted. You are muted. Yeah. Okay.
I think it's a bit tricky question and answers, but I think जो question जिन्होंने set किया है और जिन्होंने key बनाई है, they must have gone through a lot of effort and
Yes.
hard work. So I think let's not dispute it at this point. And if
Yes.
there's any dispute, they can make it record and then we can look into that. अभी इस वक्त जो है ना, we should just carry on with the answers that are given by the key.
Yes, sir. So
I
according to
would
the
say,
umpire,
I mean, I think it's I agree with the Professor.
right, sir. So anybody from the council members having any other verdict? Because I think it has gone through deliberation and the whole panel has reviewed the questions.
No, I mean,
Yes, I think that should be the way. If someone has any query regarding any question and answer, we can note down it, we can see it, and later on come up with the answer rather than answering right now at the moment, because
Exactly.
it's difficult to really go through. So right now we have to go with the key.
Yes, and we've also got.
This is what I have said.
Yeah,
I have recorded the objection, and we'll go through it.
Hamza, my point, Dr. Hamza, my point here is, I mean,
Sir.
it may, the point we are saying is it may not just be kind of typo error. So that's why we are saying, because if you are talking about low mortality, how can non-compliance lead to lower mortality than a good compliance? So it's, I think
that's our question as well.
That's, I mean, so that's it's a reasonable query, but I think the review committee must have.
I think
gone
my
through it, so
verdict
we can
is
push
to
forward
carry
the
on,
query.
and then we will look into this. Please.
Exactly.
We have the extra question. If you want to flip this question,
We can flip the question
No,
if
I
you
think
want
we have.
to.
I think objection noted, and just proceed.
Right, sir. So I think it's the umpire's call, and we'll take the call and we'll move to the next question. But we'll note down all the points from the worthy members and the council members. Question number 4, please.
Question number 4. Which of the following does not occur as part of neurohormonal response to cardiogenic shock? A, increased epinephrine levels. B, increased aldosterone levels. C, increased renin levels. D, increased NT-proBNP levels. And E, increased IL-6 levels.
Time starts now.
Our answer is option A.
Are you sure? You still have time.
न्यूरोहार्मोनल है न्यूरोहार्मोनल है
So you want to take more time?
Yeah.
Okay, take your time.
Okay, option A.
Okay, so they've locked option A. Leopards, is that true?
It's the wrong option. The correct answer is option B, increased aldosterone levels.
Yes, increased aldosterone levels. So another one missed. All right. But I'm sure we have a few sixes coming our way. So moving to question number 5.
Question number 5. The cardiac output can be estimated non-invasively in this patient by following method. A, thermodilution method. B, LVOT velocity time integral. Option C, myocardial strain imaging. Option D, cardiac MRI, late gadolinium enhancement. And option E, arterial waveform monitoring.
Time starts now. So you have 90 seconds. Come on, this one I'm expecting is going to go over the covers for a 6.
Our answer is option B.
Sure.
Can you kindly read the whole option?
You want the scenario to be read?
No, complete answer, please.
30 seconds to go.
Velocity with integral.
This is the right answer.
Okay. LVOT velocity time integral. Yes, that's the right answer. Well done. And I was keeping my fingers crossed. So, question number 6. Rather, question number 5.
6.
6, okay, yes. Move to 6.
What should be the next step in the management in this patient? Option A, myocardial perfusion scan. Option B, right heart catheterization. Option C, stress echocardiography. Option D, endomyocardial biopsy. And option E, electrophysiological studies.
Time starts now.
AP स्टडीज वाला तो इशू नहीं है. स्ट्रेस राइट बायोप्सी और राइट हार्ट का इसका कोई फायदा नहीं है.
लेकिन वो पूछ रहे नेक्स्ट
इसके डायग्नोसिस बनानी है.
I hope it's not a dusra for you. Come on, Mayo.
Failure
Approaching 30 seconds.
Option D.
Are you sure? Should we lock it?
Yes.
Okay, leopards. Is that true? Option
Can you
D.
read the full option, please?
Option D, read the full option.
And endomyocardial biopsy.
This is
Okay.
the right answer.
Yes. Well done. Option D, endomyocardial biopsy. Good one. So, next question, please. Question number 7.
Question number 7. Few samples of the right ventricular endomyocardial biopsy were taken from the interventricular septum, showed multifocal inflammatory infiltrates consisting of lymphocytes with multinucleated cells. What is the most likely diagnosis? Option A, lymphocytic myocarditis. Option B, eosinophilic myocarditis. Option C, giant cell myocarditis. Option D, Takotsubo cardiomyopathy. And option E, Chagas disease.
Your 90 seconds start now. Is this going over the boundary?
Our option is C. Giant cell myocarditis.
So, leopards, option C, giant cell myocarditis. Is this true?
Yes, this is the right answer.
Oh, well done. Well done. 3 in a row. Hat-trick. Well done. Leopards, I think you will have to bowl faster. So, question number 8 on your screen.
Question number 8. Which of the following diseases is associated with giant cell myocarditis? Systemic lupus erythematosus, B, ankylosing spondylitis, C, rheumatoid arthritis, D, inflammatory bowel disease, and E, type 1 diabetes mellitus.
Time starts now.
inflammatory disease हो सकता है.
सुन रहा हूँ. नहीं. Our option is D.
Can you mention the option?
IBD.
Read it.
IBD, inflammatory bowel disease.
So option number D, inflammatory bowel disease, leopards. Is that true?
Yes, this is the right answer.
Oh, well done. 4 in a row. Well, that's, I would say, wonderful batting going on. Okay, maybe you'll have to bring in a spinner now. So question number 9.
Question number 9, which is the next best treatment option for this patient? Option number A, high dose steroids and cyclosporin. Option B, plasmapheresis. Option C, telaregenin. Option D, intravenous broad spectrum antibiotics. And option E, bone marrow transplantation.
Time starts now.
वही देते हैं cyclosporin और steroid.
और telaregenin वो भी नहीं है. Broad spectrum antibiotics का गोल है. bone marrow transplantation.
अभी वेट कर रहे हैं.
Plasmapheresis antibodies नहीं है.
Our answer is option A, high dose steroids and cyclosporin.
So, should we lock it?
Yes.
Okay. A, high dose steroids and cyclosporin. Leopards. Answer please.
Right option. Right option.
Yes. Oh, well done. So they're on a roll, I would say. 6 again. Good batting. So with this, now move to the last question of this innings. Question number 10.
Question number 10. Patient responded to immunosuppressant therapy and improved from Intermax class 1 to Intermax class 4, but still have NYHA class 3 heart failure on maximally tolerated medical therapy. Which of the following factor makes him suitable for the left ventricular assist device? Option A, active uncontrolled coagulopathy. Option B, moderate to severe aortic insufficiency without plan to correction during LVAD implantation. Option C, AHA stage D heart failure. Option D, mechanical valve that will be converted to bioprosthetic valve at the time of LVAD implantation. And option E, reversible cardiac dysfunction.
And your time starts now.
Which of the following factor makes him
Suitable for LVAD.
Intermax 1 से
तो यार इसमें तो
ये बड़ा हो सकता है.
Can we enlarge the question, please?
Screen is not clear.
Okay, can you see it now?
No.
You can't see the question?
No.
Okay.
We can see it now.
You can see it now?
Yeah.
Yes, sir.
Okay, so timer should run. Keep the timer going, please.
अच्छा ये वैसे तो सी भी ठीक है और ई भी ठीक है.
ई ज्यादा बेहतर है.
ये चेक.
रिवर्सिबल है तो उसकी हम वेट करेंगे.
We can't see the timer. Please hit the buzzer when it's okay. 30 seconds now. 30 seconds left.
सी या ई? अच्छा, our answer is option A. E.
बोल रहे हैं reversible.
Are you sure? Should we lock it?
Yes.
So,
नहीं.
option E, reversible cardiac dysfunction. E or C?
Yes, sir.
Please say it.
E. Reversible.
Okay. Option
This
E,
is the wrong
reversible
answer.
cardiac dysfunction. Is that true? Leopard?
This is wrong answer. Option C is the correct answer. Stage D heart
They were
failure.
very close. They were very close. They nearly got it right. So never mind, but I still think we've done pretty good. So score of 36, and we finished the innings with a score of 36. Good job. I think we do have a game on our hands, and PIMS will have to perform. Leopards will have to bat well. And I would like to now take the reviews from my experts, my panelists, council members. So can we have Dr. Fawad Farooq, please?
Yeah, I think they have batted well. It's a good score. 36, I think, is a good score.
So you think we do have a game on our hands?
Yeah, I think so.
Great. Professor Dr. 𝐂𝐚𝐫𝐢𝐚 Abbas Kazmi, sir, your
I think
input,
we should
please.
proceed. We should keep the comments at the end.
Right, sir. I think they may have to
Acha, yaar.
change the connection at Mayo because they're having some issue. So we probably will have some time at hand. So quickly we can have the review, sir, if you allow.
I think they did very well. Some of the questions are a bit difficult, some basic stuff there. I have made some suggestions to the council regarding future questions and the number of questions and what areas to be covered. So I think, I mean, this is exam. Exam may, you can never have an ideal exam. Everybody should pass. It's a matter of competition. It's a matter of test of your knowledge. So I think इसमें काफी चीजें provoke होती हैं. Even we get got a sort of hints के भाई हमें क्या क्या और देखना होता है. So I think ठीक है, but there should be mix of clinical and basics.
Very true, sir. I think whenever we are trying to compete, we are all competitive and the emotions come into play. I think Dr. 𝐂𝐚𝐫 Kazmi is there. Please, sir.
Yeah, I think my suggestion is that whether it's a correct answer or a wrong answer, so whichever team is posing the question, they should probably just in 2 sentences also give an explanation why which one is the correct answer. So I think that will make things a little more educational.
I think it's a very good suggestion, sir.
लेकिन सर उसमें बहुत टाइम लग जाएगा, डिस्कशन में बहुत टाइम लगेगा. I think we should take their objections and analyze the objections and get in touch with the people who have formulated the questions and come up with a proper resolution to the issue. अगर इस तरह हम हर केस को डिस्कस करने लगेंगे तो I don't think we can finish in due course.
No, I think, sir, Dr. 𝐂𝐴𝐚 doesn't mean that the conflict resolution right at the moment. What he's saying, which I do consider so, that whenever a correct or wrong answer is the verdict given by the team, there should be just a one-liner explanation why. Nobody is going to further argue about it, whatever on the basis of what they have formulated that answer in their team. They should just giving a one-liner, even the team or maybe coach or mentor sitting in the competition.
एक लाइन में तो आप एक्सप्लेन नहीं कर सकेंगे. It's not a mathematics. Physiology के क्वेश्चन है, उसमें आपको टाइम लगेगा एक्सप्लेन करने में.
And we can take that time. I personally feel 90 seconds is quite a long time to answer. You can cut 60 seconds there for answer and 30 seconds for just a quick explanation with timer. That make it more educational because just yes, no, they all are, and right now the audience is really building up. So whoever is really saying should have some idea why this is wrong and why that's right. That's just a suggestion. We'll see the practicality if it's possible. If it isn't possible,
I think इसी तरह चीजें evolve होती हैं. आप अपने suggestions लिख के भेजें, मैं भी भेजूंगा, and we can make it better, you see, and more productive and more educational.
Hamza, if things are ready,
we are learning as this is happening. We are learning as well. This is something
wonderful
new.
Suggestions. Wonderful suggestions from everyone.
Another quick suggestion is which can add more thrill is that if we cut it down to 60 seconds for answer.
Yeah.
Yes.
If a team answers in 30 seconds, you give them 6 marks. After 30 seconds, then 4 marks.
Yeah,
I think so. That will add more thrill and I think a little more competitive that you need to go through it quickly.
I think wonderful suggestions all the way, I would say, and I would like to thank everyone. I think we have Professor Jalal. Sir, your comments, please.
परेशान हैं, कुछ सोच रहे हैं परेशानी में, नया पाकिस्तान बना रहे हैं.
Can we have Dr. Jalal? Oh yes.
टेबल पे पेशेंट छोड़ के आ गए हैं ना.
हाथ उनका सर पे है, अल्लामा इकबाल स्टाइल से.
अभी वो स्टैंड डाला है, अभी उसको डिलीट करने में इधर पहुंच गए हैं, तो वो सोच रहे हैं कि जाके पोस्ट डिलीट करूं नहीं करूं.
तरह की स्टोरी थी कल रात को. लास्ट केस कोई 3:30 बजे खत्म हुआ है. Again, a very complex, just a bit shock.
Are you ready with the team?
Yes.
PIMS team?
Hamza, please give us the cue. Are we ready?
Yes, sir, we are ready.
Okay,
Okay.
go ahead, please.
Okay, so now,
I'm sorry, I have to leave a bit early. I've got an appointment with the GP.
right, sir. So we'll try to make it as quick as possible. Moving to the second innings. So do we have the teams ready?
हमने सवाल पढ़ने के बाद
So
Yes,
Mayo,
sir, I'm ready.
Mayo Kingfishers, your scenario, please. Read the scenario, which should be on the screen.
ये उन्होंने नाम के साथ अपने बड़ा खतरनाक लगाया है लेबर किंगफिशर्स
Okay. 55-year-old male, well, acute onset of shortness of breath, along with chest pain of moderate intensity, exacerbate with the deep inspiration. He was admitted in hospital for fracture of hip and femur after road traffic accident. His current vitals are blood pressure of 120/80, pulse 110 per minute, and respiratory rate of 21 per minute, and he's afebrile. He has a computed tomography angiogram in the emergency room and is noted to have bilateral, segmental, and subsegmental pulmonary embolism. His past medical history is significant for non-small cell carcinoma of the lung, for which he is undergoing treatment. He reports of nausea and vomiting.
Okay. So leopards, are you ready for the question? Can we have question number 1 on the screen? You can take your time.
I think leopards, you can make it points, you can write
Yes.
down the question points. Yes,
Yes.
you were doing right. So that in future it will be helpful when you get further cues regarding these questions.
Very true, sir. Good points by Dr. Fawad Farooq. Now, I think we should move to question number 1.
I have a question. Can I ask a
Okay.
question, please? The question is, the time of chest pain is not mentioned and the time of fracture is not mentioned. So can they tell us that?
Okay.
He recently has a fracture, and I don't think chest pain has to do something with the question.
I
Maybe
don't
take it
think you
as it
can
is.
ask
Okay,
questions.
I
I
think
think for the
we'll-
scenario, yeah. So you can't.
Please take it as it is.
I think we should
Okay,
have question
okay.
number 1 on the screen now, please,
Okay.
and read the question.
Which of the following would be the choice of anticoagulation? Option A, warfarin; B, low molecular weight heparin; dabigatran; and edoxaban.
Timer starts now. 90 seconds.
Pregnancy.
Ali, my suggestion would be B.
Okay, no suggestions. I think focus on the question and the answer, please.
No, I'm part of the team.
She's a
so
team
I
member,
have-
sir.
Okay, you're a team member. Okay, okay.
Yes.
Okay, you can suggest to your team. Please go ahead. Please go ahead.
Molecular weight heparin is fine.
Dr. Muniba?
Hospital
Yes.
admission ही है ना?
Thank you, sir.
Hospital admission है ना?
I think what you can do, you can chat with your team because one person has to come up with answer finally.
Yes, we
Ali
will.
do the
I
one.
will give the answer.
Okay.
Is this a hospital admission? है ना?
Uh-huh.
So, our option is option
30
B,
seconds.
low molecular weight heparin.
Are you sure? Option B,
Yes.
low molecular weight heparin. Option B. All right. Is that true, Kingfisher?
Yes, it's the right answer.
Oh, well done. So that's a
पहली
good
बॉल
start.
पे छक्का.
पहली बॉल पे छक्का है सर ये तो. Oh, that's good going. So question number 2 on your screen now.
A patient is with deep venous thrombosis of the leg, not cancer associated. What would not be the choice of anticoagulation for the first 3 months? Dabigatran, rivaroxaban, apixaban, edoxaban, or warfarin?
Question. Okay, so timer is on now. 90 seconds.
your suggestion?
E, I think because NOACs are recommended first line as compared to warfarin. Because they are saying that the patient is not having cancer here.
So what about option C?
Apixaban is recommended. Apixaban, rivaroxaban is recommended.
So I think so we should go with option C.
But what about option A?
No, they said which would not be the choice of anticoagulation.
Not the choice
Okay.
in this statement.
Sorry.
B, C, D are okay. What about A and E?
Then you want to go with warfarin?
Or dabigatran?
I'm not 100% sure about dabigatran, but I'm sure about BCD.
30 seconds left.
What should we go?
Warfarin, let's go with warfarin.
Okay, you want me to lock it? Is that the answer?
Yes. Ali?
Yes, lock the option E, warfarin.
Okay, option E, warfarin. Kingfisher, is that true or
Yes.
false? Okay, I
Yes.
think we have the right answer. Wonderful. Another 6. That's a great start. Okay, they want to knock down the runs quickly. Okay, question number 3 on your screen. Now,
Initial parenteral anticoagulation is a must with what agents when used to treat non-cancer associated DVT or PE? Option A, rivaroxaban and apixaban. Option B, dabigatran and edoxaban. Option C, rivaroxaban and edoxaban. And D, dabigatran and apixaban.
Ali, it is
okay,
option
time
B.
starts now.
मेरी सजेशन ये है कि टीम आपस में जब बात करे तो माइक ऑफ कर दें और जब आप किसी पे डिसाइड कर लें तो फिर the team leader should come up with the answer.
Sir, I'm
Right, sir.
consulting.
It's
You can discuss among yourself.
Dr. Muniba is sitting in a remote location. She's not
Yes.
sitting in
Okay, okay, okay.
actually she's online with us, sir. So she'll
All right, okay.
have to.
That's
You were
fine.
saying about
Just wait
option
like that.
D, rivaroxaban does not need anticoagulation. IV, apixaban does not need that. So option A is out, option C is out, and option D is out. So the left option is option D, dabigatran and edoxaban.
Should I
So
lock the
lock this
answer? Is
option
that
kindly.
true?
Option B,
Yes.
dabigatran and endoxaban.
So
Yes.
it's option B, dabigatran and edoxaban. Is that true? Mayo Kingfishers.
Yes, it's the right answer.
Oh, it's the right answer. With a heavy heart, he says it's the right answer. Wow, 3 6s in a row. And I liked the analytical thinking. That was pretty quick. Well done. Now, moving to question number 4. Come on, PIMS Leopards.
What is the recommendation for dabigatran dosing if prescribed with dronidaron? Continue at 150 mg BID and reduce dose to 75 mg BID. Stop using dabigatran, reduce dose to 75 mg once daily.
And timer starts now.
Class 3 and 2.
Ali, इसमें dose reduce करते हैं. I'm not sure. अब मुझे recall करना है.
We have time.
I think their discussion is making it more lively as compared to
Exactly.
pause kind of
That's what I
situation in
always
90
thought.
seconds.
What is the recommendation for
You have
dabigatran
all the
dosing?
liberties to discuss as long as you're not finalizing.
Dr. Muniba, are you sure we have to reduce the dose?
Yes, that I am sure. मुझे exactly dose याद नहीं आ रही dabigatran की इस वक्त ना. आप कम वो करते हो, dose को reduce करते हो, but आप खत्म नहीं करते हो. ये मुझे याद है.
So we have to either go with B or D.
Yes, हाँ. Normal dose याद है किसी को?
Approaching 30 seconds now.
150 BD.
So let's go with 75.
को याद है.
Option B, that would be a feasible option.
Yes, go with B.
Our answer is option B, reduce dosage to 75 milligram BID.
So option B, reduce dosage to 75 milligram BID.
It's
Is
the
that
right
true, Kingfisher?
Yes.
Oh, that's another true answer. Wonderful.
किंगफिशर का पहला ओवर जो कर रहा है उसी ने सारा मैच निकाल दिया पहले ओवर में ही मैच चला जाएगा
They are batting so sensibly
Yeah.
and the thinking, the analytical thinking, the camaraderie, wonderful.
Yeah, Muniba is the star batsman here or batswoman here.
Wonderful, wonderful, great. I think we still could have a match. Come on, Kingfishers.
हमजा की आवाज आ रही
Sir, आपकी अब आ रही है आवाज. Yes, we can
I
hear
think
you.
the other team is going to hire Muniba next time.
तो पहले ओपनर्स अच्छे थे उन्होंने कमजोर थे ओपन जरा थोड़ा सा वीक हुआ था
बिल्कुल.
I think their openers are good, so let's see how the middle order and the last order goes.
Exactly.
Next, please.
Next question, please. Bowlers, buckle up.
What is the recommendation regarding starting dose of dabigatran if patient is on ketoconazole? Start on 150 mg BID. Do not use dabigatran. Start on 75 mg BID. Start on 75 mg once daily.
Timer starts now.
कीटोकोनाजोल इंड्यूसर है reducer वो इंड्यूसर है ना साइटोकिन
Inducer. Inhibitor है
नहीं इंड्यूसर
ketoconazole is inhibitor of multiple enzymes.
इनहिबिटर है तो फिर हमें उसको जो है डोज को रिड्यूस करना पड़ेगा.
I think so.
श्योर मुझे तो याद है
Muniba, we think it's an inhibitor.
कीटोकोनाजोल इनहिबिटर है I think inhibitor है.
CYP 450. So we will have to reduce the dose.
I think इसकी भी वही ड्रोन वाली डोज है. Not sure on this one.
Or rather do not use it.
नहीं, do not use तो नहीं होगा.
नहीं आपने डोज रिडक्शन करनी है आपने दे सकते हैं.
omit नहीं करना.
नहीं हाँ omit नहीं करना आप दे सकते हैं.
Either C or D.
Less than 30 seconds are left. So
go with option C again. What do you suggest?
Yes, I think C.
Our answer is option C. Start on 75 milligram BID.
So option C, start on 75 milligram BID. Is that true, Kingfishers?
Yes, it's the correct answer.
Oh my goodness. Another one true. Wonderful. Great batting. I think they're just smashing it out of the park.
Bowler change karo.
Great. I think you'll have to bring in a new bowler, maybe a spinner, Chinaman or something. So question number 6 on your screen.
Which of the novel anticoagulant is mostly excreted through the kidneys? Dabigatran, rivaroxaban, apixaban, edoxaban.
Timer starts now.
Edoxaban or dabigatran? Edoxaban की नहीं.
Edoxaban, rivaroxaban, dabigatran तीनों नहीं दे सकते. आप सिर्फ जो CKD के पेशेंट्स हैं ना उनके अंदर 1.5 से आपकी जब क्रिएटिनिन कम होती है तो आप apixaban की डोज कम करते हो with another risk factor. और जो आपके डायलिसिस डिपेंडेंट पेशेंट है apixaban आप उनको भी दे सकते हो. तो I'll go with option C.
But नहीं
अच्छा सॉरी मैंने गलत पढ़ा. ठीक है.
नहीं देनी वो बताना है मैडम. I think
नहीं which of the novel anticoagulants mostly excreted through the kidneys? Rivaroxaban. I would think rivaroxaban.
Yes, I would go with that because
इनमें से edoxaban
that is actually the excreted through the kidney.
50 पे हम किसकी डोज रिडक्शन करते हैं?
Rivaroxaban.
I guess हाँ 30 पे edoxaban की करते हैं और rivaroxaban पे भी 50. Okay, go with
30 seconds.
So Muniba, we should go with option B, rivaroxaban.
Yes.
So
yes, Ali.
नहीं, initially you were saying कि which of the anticoagulant is not given.
10 seconds. Come on.
Our answer is option B, rivaroxaban.
So option B, rivaroxaban. Is that true, Kingfishers?
It's the wrong answer. Option A.
Oh, it's the wrong answer. Okay, so we still could have a match. So good one. But I don't know, but honestly, the way the PIMS leopards are playing it. I think there's always a method behind every madness. So let's see what happens on the next one. Next question on your screen.
Which of the following novel anticoagulants is a direct thrombin inhibitor?
Option C.
River.
Ali. Sorry.
Option C.
Sorry.
Okay, let him give all the options. Quick options. Come on.
Rivaroxaban, apixaban, dabigatran, and edoxaban.
Timer starts now.
Option C, dabigatran.
Should we lock it?
Yes.
Sure?
Yes.
We can't have a review after that. Okay. So, question number C. Question number 7. Answer C, dabigatran. Is that true, Kingfishers?
Yeah, it's the right answer.
Oh, I think this one was straightforward, well played. So they are being very careful and they're very quick as well. Well done.
Score levels.
Scores are level now. So very extremely crucial last 3 deliveries. Last 3 questions. Question number 8 on your screen now.
Which of the following drugs has been approved for use to reverse the effect of dabigatran? Idarucimab, dexanet alpha, aripazine, and protamine.
Timer starts now.
Ali, what about B?
ये उसका नहीं है, apixaban का नहीं है.
फिर A.
A and B में से.
प्रोटामीन नहीं है.
प्रोटामीन तो नहीं है.
प्रोटामीन नहीं है.
नहीं प्रोटामीन तो नहीं है. एडेनेक्सन ये उसका एपिक्साबैन का वो रिवर्सल एजेंट है.
Then A.
नहीं एक मिनट.
मैं इसका नाम.
Ali, it's A.
Option A.
Yes.
Confident. Our answer is option A. Adrucizumab.
You want me to lock it?
Yes.
So option A, adarucizumab. Kingfishers.
It's the right answer.
Oh, it's the right answer.
Match over.
Match over. Well played. But I think the way they are doing it, well played, PIMS, Leopards. I think wonderfully played. We still have 2 more deliveries. I think we should go to the last ball.
3 more deliveries.
So we want
2 more deliveries.
2 more deliveries to go.
No, 2 more deliveries.
2 more deliveries. Question number 9 on your screen. Because we all want to learn here.
Which of the following drugs is being studied to reverse the effect of apixaban and rivaroxaban? Edorucizumab and dexanet alpha, aripazine, and protamine.
Timer starts now.
ये approved है? ये approved है?
हाँ?
ये approved है ना? Adixonalate जो है?
जहाँ तक मुझे याद है.
अगर ये approved है तो फिर अभी study तो नहीं हो रहा ना?
हाँ, मतलब फिर मैं यही कह रहा हूँ, ये तो इसका तो established है, I guess. नहीं हुआ? Sure है? The team members are suggesting option B. What do you say?
You go with B. अब तो address कुछ नहीं है. नहीं B.
And dexanet, na?
Yes.
Our answer is option B. And dexanet alpha.
Option B and dexanet alpha. Kingfishers.
It's the right answer.
Oh, right answer. Well done. I thought this was most likely going to go for a 6 since they are playing so well. And I think they're pretty aware of all these antidotes. So well played again. Moving to the last question. Question number 10, please.
Which of the following drugs is being evaluated as a universal anticoagulant reversal agent for all the anticoagulants? Option A, edorucizumab, and option B, and dexanet alpha, option C, eripazine, and option D, protamine.
Time starts now.
I think so. We should go with option C, Muniba. What do you suggest?
वही बचता है.
These are repetitive options which are the following representing
Process of exclusion.
Ali, go with C.
नहीं वैसे प्रोटामीन के इनसे एक मिनट
Protamine तो हम already.
लेकिन इन सबको तो कर रहा है वो
Direct thrombin inhibitors में.
A and C में से कोई एक. A को
नहीं,
एक का हमने उस पे किया
इसको क्या कहते हैं?
eripazine.
ठीक है.
Should I lock option C? You are okay with it, Muniba?
Yes, I'm okay with it.
Option C, eripazine is the right answer. Is our answer.
Okay, so their answer is eripazine, option C. Kingfisher.
Yeah, it's the right answer.
Yeah, their answer was the right answer. Well done. Well done. So you just missed one question, and we have a total score of 54. And I would now request our worthy umpire, Professor Dr. Ishaq.
Hamza, I have to go
Very
for an
well played,
appointment,
Dr. Muniba.
so I'll make my
Right, sir. Please,
submission.
sir.
And first of all, I would like to congratulate the PIMS for their glorious victory. Very outstanding performance by them. 56 versus 30, 54 versus 36. But that should not discourage the MAYO from, you see, going through again about these questions and physiology. I think the question from PIMS was a bit more physiological. This was more therapeutic. But I think this is medicine, and we have to have a combination of all the various sections of cardiology. So I think the competition went very well. I have noted the question which was raised, question number 3, I think, and we will look into that. And if there's any objection, I think it's the wise thing is to submit their objection with some background. Recently, I had some objections were referred to me by AFIC and the last match which I was not attending. So I have also given them appropriate comments with respect to references from the literature. So I think Professor 𝐂𝐚𝐫 is there. I would leave it to you. I have to have an appointment at 11:30 over here. It is right now. So thank you very much for having me. And I think this is a very healthy competition. We should go on, and Dr. Muniba needs to be complimented for guiding her team into the victory.
She was the Jayasuriya for them. So
yeah, with this, the moderator again did a very nice job, and Mrs. Wilson, both the Hamzas need to be complimented, and Professor Fawad Farooq has made some good suggestions which should be incorporated. And I leave it to Professor 𝐂𝐚𝐫 to have the final words. But once again, congratulations, PIMS, for outstanding performance. And Allah Hafiz, we see you next Saturday, inshallah.
Coach.
Great to have you, sir. Professor 𝐶𝐚𝐫, sir, can we have you?
I think congratulations to PIMS, outstanding performance, especially I think star Muniba. So advice to Kingfishers is your scenario was good. I think the questions you had made were, I mean, one question was last 4 questions were actually self-explanatory. So you didn't have to really worry too much. I mean, you knew one, so you could answer. So you need to put in more effort in formulating better questions. And maybe, I mean, change subject. You don't have to just hang on to Dabigatran or, I mean, low molecule. There are so many other things with the deep vein thrombosis and pulmonary embolism. So, I mean, just expand your horizon with when you're making questions rather than being so narrow. So that's my advice. And very well done. Thank you, Hamza, both Hamzas. I think And best wishes again, I think, for both teams for their future contests. Thank you.
Thank you very much, sir. And it's always great to have all of you. Professor Dr. Fawad Farooq is there and Professor Dr. Jalal. So please, your inputs. Do we have Dr. Jalal? Yes.
You did a very moderation over here. Or better.
I think
सर आपकी आवाज थोड़ी सी हमें कट के आ रही है. I think it's breaking a bit, but
बुक में लिखा हुआ है.
जी जी हमजा आवाज
सर अब आ रही है. We can hear you now.
हमजा
लिखा होता है बेशक देख ले. बुक में यहाँ पड़ा हुआ है.
Can we mute others, please, so that we can only hear Professor Jalal?
टीम है उनकी जो क्वेश्चन और
Jalal, your voice is very low, sir. We are unable to hear.
Sir, आपकी हमें it's breaking. आपकी बीच में ना we are unable to hear you. It's breaking quite a lot. So...
हेलो
जी जी
आप लोगों की आवाज मुझे बड़ी क्लियरली आ रही है.
सर अब आपकी आवाज हमें आ रही है. Now we can hear you clearly.
Okay. So I think I congratulate the winner team, PIMS Leopard. They really answered the question very well. उनका जो interaction था बहुत अच्छा था. Dr. Muniba, I think इनका और बाकी जिस तरह से उन्होंने एक मशवरा करने के बाद ही reply किया, I think that was very good. I think the other team जो है किंगफिशर ने भी बहुत अच्छी फाइट की. जिस तरह खावर ने कहा उनके क्वेश्चन एक ही पैटर्न पे चल रहे थे. They needed some variety in their questions. और वो 4-5 ड्रग्स के हवाले से सारे वही सीन थे. And Islamabad Leopards were very lucky to have such questions from the opposite, from the Kingfisher. Oh, they were. I would say they were very fortunate to have such questions over there. But anyhow, very well played both the teams. I congratulate to both the teams. And I think for Kingfisher, next time, inshallah, you will do well. And again, I'll give a big hand for you comparing. I think you cricket तो सब पाकिस्तानियों के खून में I think चल और आपने इंटरेस्ट और बेहतर कर दिया दोनों टीमों की तरफ से. और जो सुनने वाले लोग हैं, listeners, I think everybody would like such sort of competition. So best of luck for the next to Kingfisher, and very well done, Islamabad PIMS Leopard. And congratulate to Dr. Nasir. Nasir is a good friend. I think he was the leader of the PIMS. So congratulate to all PIMS team. Thank you.
Thank you very much, sir. It was great to have you. And we are all cricketers, bowlers and batsmen at heart. So I think this is what we thrive on. I think we have Professor Dr. Fawad Farooq. So your input. Comments, please. Is he there?
Don't see him. I think he is disconnected.
So I think maybe he has left the arena. So I think, sir, with this, we would now like to conclude. And I think two things which are, I think, so wonderful about this competition. And one aspect is the way it up. And I think the fact that they're not given questions and they are making questions themselves and throwing it makes it even more interesting, because then they are involved in the game even before the game has actually started. So I think we must continue with this. And the other aspect of this game is the way they discuss it. I think that aspect on screen while they are discussing makes it even more interesting for all of us. And it's all a learning experience. I think the competition is always there, but at the end of the day, we all have to learn from this, and we are all learning throughout our careers. So with this, I think I would now like to thank all our senior council members, our worthy guests, and both the teams. And well done, both the teams. And thank you very much. That's it for today.
Thank you.
Hello. Dr. Jalal wants to say something.
Ji, sir, please.
क्वेश्चन थर्ड एंड फोर्थ के रिगार्डिंग था कि वो काइंडली रिव्यू कर लीजिए।
ठीक है, वो हो जाएगा। Well noted. I think we'll have it reviewed. Don't worry.
हमजा आवाज
सर आ रही है आपकी आवाज?
बस ठीक है। वही सजेशन डॉक्टर फवाद और डॉक्टर खावर ने एक बड़ी अच्छी सजेशन दी। आई थिंक आई वुड एग्री विद दैट सजेशन कि आंसर रिप्लाई के लिए अगर आप 60 सेकंड्स दे आर गुड इनफ, अगर आप अटेंटिव रहे।
Exactly.
30-40 सेकंड्स स्पेंड होते हैं उसकी एक्सप्लेनेशन में, एक दो जुमलों में, आई थिंक दैट विल बी वेरी गुड additive for both the team and for us as well. So that was a good suggestion. I totally agree with that suggestion. Fawad Tonite on behalf of Fawad.
Sir, points well noted. I think these two things should be implemented, and we also feel that 90 seconds is a bit too much, and some explanation should come, maybe a one-liner with some reference. Although there is a team, there are members there's a review committee for all the questions. They are reviewing it, and it's all referenced mostly. But then again, it's always good to have the answers so that if somebody's getting it wrong, the idea is to learn. So everybody is then clear. So anything else from anyone?
I want to add on about the question number 3, where the colleagues were having a confusion. It was about the admission parameters. If a patient has low compliance to medication, that will in turn, during hospital admission, will have a better compliance, and that will be a low mortality factor. That was the question. That was the answer.
So if the reason of admission is non-compliance, then the improving compliance will improve the outcome.
Okay, so that's so I think that's the aspect which okay.
I don't think that's clear.
I mean, I think we can have a debate on it separately.
Yes,
The committee, I mean, can do that. In this contest, I mean, as far as MAYO Kingfisher, I mean, that point is valid and that will be discussed, but I don't think that question, yes or no answer, would make a difference to the overall contest, because the difference
Sir, run rate better ho jayega.
Only the run rate, no difference otherwise. So I think this is well noted. It will be reviewed by the committee. So thank you very much. I think with this we will all leave. Thank you, sir.
Great, very well done. Thank you.
Thank
Khuda
you,
Hafiz,
sir.
everyone.
To all the senior members for joining us today, and congratulate PIMS Leopard. They have put on the highest run ever from the 5 matches. They have scored 54 runs, which is till date the highest runs. All to PIMS. Thank you very much.